This is a really important story both for Ohio and for the nation in general. Her miscarriage left her bleeding profusely, and Ohio ER sent her home to wait. Before I even go over the story with you, I want to talk about what the law actually says in Ohio. This is from Ohio Revised Code section 2919.11. It defines abortion legally, and it says abortion means the purposeful termination of a human pregnancy by any person, including the pregnant woman herself, with an intention other than to produce a live birth or to remove a dead fetus or embryo. This is very important because there are different kinds of miscarriages. One of them is what's called a missed miscarriage, where the embryo or fetus dies, but the woman's body does not pass the remains naturally, and she needs some kind of intervention to remove the remains. Under Ohio law, any kind of intervention to remove the remains, even if it's identical to interventions for abortion, is not legally an abortion and is absolutely allowed. Missed miscarriages are definitely not the only kind of miscarriage. Another important kind is called inevitable miscarriage, or sometimes it's called inevitable abortion. Inevitable miscarriage is when you have vaginal bleeding and you have dilation, and it basically looks inevitable that you are going to miscarry. With an inevitable miscarriage, you could still have embryonic or fetal heartbeat, but the conditions are there that you are going to have a miscarriage. The reason I bring this up is because even when you have detectable fetal heartbeat, Ohio law allows for medical intervention in the event of an inevitable miscarriage where there is some kind of medical threat or emergency. So this screen cap is from Ohio Revised Code section 2919.16 Part K, and it's talking about exceptions to the Ohio abortion law, which include serious risk of a substantial and irreversible impairment of a major bodily function. And they explicitly list examples, this is not every possible situation, but it's some examples, of preeclampsia, inevitable abortion, and premature rupture of membranes. So Ohio abortion laws very explicitly allow for treatment of missed miscarriage and treatment of inevitable miscarriage in an emergency situation. So what happened with this lady? She was having a miscarriage. She lives in Washington, D.C., and her D.C. practice told her that they think she should wait and see if she passes the remains on her own. This is not a strange thing for doctors to recommend for women who are miscarrying. There are multiple reasons that a doctor might not want to intervene when there's a miscarriage. One of the reasons is a lot of times they want to make sure she actually definitely is going to miscarry. You could have a situation where it seems like you're going to miscarry and then it turns out that it works out all right. And you wouldn't want to have the medical team intervene too early and end a wanted pregnancy that was otherwise going to be okay. Another reason is even if they are sure she has had a missed miscarriage or they're sure she's having an inevitable miscarriage, is that they want to let her pass the remains on her own because they think that that is safer and better for her body. That's why you have her OB in Washington, D.C., which has no limits on abortion at all, still decline to intervene and instead recommend that she wait and see if she passes the remains naturally on her own. Doctors say that all the time. And because miscarriage is so little understood, a lot of people don't realize that sometimes that can take weeks, and that's not an abnormal thing for doctors to recommend women try before they go for a surgical or medical intervention. Remember that when you hear all these stories of women saying they had a miscarriage and had to carry their dead baby for weeks. That sounds incredibly traumatic. It's also not specific to anti-abortion states. It's not specific to states after Dobbs. It's a common thing that medical providers recommend for women going through miscarriage. So this woman and her husband go to Ohio, I think, for a wedding, and while they're there, she starts bleeding a lot, weeks after the doctor in D.C. told her to wait. And so she goes to the emergency room. The staff there check her vitals, see what's going on, and they say that there's nothing to be too concerned about at this stage, which is, again, not uncommon. The staff end up sending her on her way, saying they don't think they need to intervene, and she and her husband interpret this as possibly, although they're not sure, having to do with Ohio's abortion laws. There's no indication that's the case. Even in this article, they talk about how staff at the hospital said that if there's a lot of heavy bleeding, they will do a D&C. They clearly weren't resisting the option of D&C. They're the ones who brought it up. So they send her on her way. She keeps bleeding a lot. She starts to pass out because she's losing too much blood too fast. They bring her back to the same ER and they do the D&C. When the whole ordeal is over, she files complaints, rightly so, with the Ohio hospital and with the OBGYN practice that she saw in Washington, D.C. This is an interesting juxtaposition because nowhere in the article or anywhere else in these conversations does anyone wonder why there were mistakes made with the Washington, D.C. practice where they didn't fully inform her what was going on or what to expect or tell her about any risks. Nobody speculates there that it was because they were afraid they would get in trouble because of anti-abortion laws, because there are no anti-abortion laws. Washington, D.C. doesn't even have gestational limits on abortion. But if you can see that medical practitioners who are clearly pro-choice or at least in pro-choice states still make mistakes, then you should be able to recognize that there could be mistakes made in places with anti-abortion laws, and it doesn't mean the anti-abortion laws forced those mistakes. Another way to think about this is just to do some basic math. Ohio in 2021 had something like 130,000 live births, and if you look at the rates of abortion and miscarriage and so forth and back calculate, that means that there should be somewhere between 10, maybe 20,000 miscarriages in Ohio every year. If it were really the case that medical providers are all too afraid to treat miscarriage, you should be hearing tons of stories of women almost dying because they couldn't get treatment for miscarriage. Instead, you could find hardly any at all, and usually when you read them, they are ambiguous like this, where it's not at all clear that the problem was because of a law. Important to note too that in most of these stories, maybe all of these stories, you don't get to hear the perspective from the medical professionals that were involved because of patient confidentiality. They can't correct the record and explain any missing information or misunderstandings between them and the patient that would give them medical reason to do the things that they did. It is extremely common in medical cases for the patients to not fully understand, either because they don't have the education or because the providers are really bad at explaining things, what exactly is going on or why the providers are making the decisions that they are. But that doesn't mean the providers don't have good medical reasons. It could just mean that their communication sucks. In fact, they had that in this article where the DCOB didn't communicate clearly at all with his patient. But we'll never know because in these stories, the hospital or the doctors involved can't give any specifics about what happened. Either way, you have rare and ambiguous stories like these that are almost always about wanted pregnancies where the woman gets into a dangerous situation and can't get the care that she needs. And then you have to make a ton of unfounded assumptions to get from that to we shouldn't have any restrictions on abortion.